Ever find yourself squinting at a menu lately, blaming the dim lighting, even though you're secretly kind of worried it might be your eyes?
Well, you're not alone. Today, we're doing a deep dive into something that affects pretty much everyone eventually, nuclear cataracts.
It's true. It's incredibly common, and understanding it can really, really help people take control.
Totally. Our listeners are all about taking charge of their health. And you know what's interesting? While I was researching for this episode, I came across this thing called second sight that can happen with cataracts.
It really surprised me. We'll get into that later on, but first, let's break it down to basics here. What exactly are eye nuclear cataracts?
Well, so picture the lens of your eye, right? Like a camera lens.
Alright.
Nuclear cataract is what happens when that lens, the center part, it's called the nucleus, gets cloudy. It's gradual. And it's actually caused by proteins inside the lens breaking down. Over time, these proteins, they kind of clump up. And it's these clumps that mess with light passing through. And that's what gives you cloudy vision.
So instead of a nice clear image, it's like someone smeared, like, I don't know, Vaseline or something on our inner lens.
Exactly. That's a great way to put it. And this type, the nuclear cataract, this is the most common one out there.
Hmm.
I mean, there are other types, yeah, caused by things like, injuries, maybe radiation exposure. But our focus today is going to be on this main one, the nuclear cataract. It's the one most of us, or someone we know, are statistically likely to experience.
Okay, that makes sense. So it's not just me trying to justify buying those expensive reading glasses early.
This is a normal aging thing for most people.
Yeah, you got it. Age is a big factor, definitely. But it's not just about getting older. There are a few things that can really speed up how fast these protein clumps decide to mess with our vision.
Okay, so why is age such a big deal then with cataracts?
What is it that happens in our eyes as we age?
Well, as we get older, the proteins in our eyes, they naturally start to break down. Think of it like when those proteins are organized, they let light pass through perfectly, clear image. But over time, those proteins, they can degenerate and clump together, like leaving a perfectly organized bookshelf alone for years. Things get a little jumbled, dusty.
So much for my minimalist dreams. Even my eyes are hoarders.
But seriously, are there things besides age that we can control? Things that might speed up this whole cataract thing?
Are we talking big lifestyle changes?
Oh, yeah. Lifestyle, definitely important. We can't, totally stop those protein clumps, but we can definitely have some say in how fast that bookshelf falls apart.
So what should I be on the lookout for? What are these cataract accelerators we're talking about?
Well, some are probably no surprise. Too much sun, old eye injuries, even some health conditions, those can all play a part.
Hmm.
But some others, maybe not so obvious.
Okay, you've got me intrigued. What kind of surprises are we talking?
You know that too much smoking, drinking too much alcohol, that can really increase your risk of cataracts.
Really? I knew those were bad news generally, but I don't know. I always thought of those as being bad for other things, not my vision.
It's all connected. Those habits, they create what's called oxidative stress in the body. Basically, it's like rusting, but from the inside out.
Hmm.
And your eyes, they're part of that internal landscape, unfortunately.
Oh, no.
This oxidative stress, it damages cells,
Right.
including in your eyes, and that damage, it makes those protein clumps even worse.
So putting down the cigarettes, cutting back on the cocktails, that could actually help me keep my vision longer. Food for thought. But, okay, let's say those protein clumps are forming. My inner bookshelf is starting to look more like a hoarder's paradise. What am I going to notice? What are the, telltale signs that a nuclear cataract is, setting up shop in my eye?
That's the tricky part, you see. Nuclear cataracts, they're sneaky. They develop so slowly. So those changes in your vision, they can be really, really gradual.
Gradual enough that you might just think, oh, I need a new prescription.
Exactly. Super easy to just dismiss it, just eye strain. Or maybe you just need new glasses.
Yeah.
But there are a few things to watch out for.
So what should we be looking for? What are the red flags?
Common ones: blurry vision, cloudy vision, almost like looking through a fogged up window. You might have trouble seeing colors as vividly, especially those subtle shades.
Hmm.
Bright lights might seem too harsh, or you get those halos around them, kind of like when you're looking at streetlights through a rain-streaked windshield.
Okay, those all sound, yeah, pretty alarming. But before we move on to what we can do about it, can we circle back to that second sight thing we mentioned earlier? What is that all about?
Oh yeah, second sight. It can really throw people off because some folks actually get a temporary improvement in their close-up vision before it gets worse again.
So it's like a false glimmer of hope before things take a turn.
You could say that. It happens because the lens of your eye is actually changing shape as the cataract develops.
Yeah.
And for a little while, this change can actually make it easier to focus on things up close, like your eyes are trying to compensate.
But that's not actually a good thing long term, right?
Right. Unfortunately not. I mean, it might seem like, hey, my vision's getting better,
Yeah.
but it's usually a sign that the cataract's getting worse. And it might even make people wait longer to get help, which is why, we got to talk about it.
Oh, the worst kind of buy one, get one free deal. Okay, so say I'm noticing some of these symptoms, maybe even that weird temporary close-up vision thing. What are my options? Is there anything that can be done? Or am I, like, destined to walk around in a blurry world forever?
Hey, good news. Cataracts are very treatable. You are not destined for a lifetime of blurry vision.
Okay, phew. That's a relief. Tell me more about these treatment options. Is it as easy as, like, getting a new pair of glasses?
Not quite that simple. There are two main approaches we use, surgical and non-surgical. But, and this is important, surgery is really the only way to actually get rid of the cataract itself.
So what's the point of the non-surgical stuff, then?
Think of it like management,
What?
especially in those early stages, like using brighter reading lights, maybe a magnifying glass, even anti-glare sunglasses can help you get the most out of your current vision and maybe even help slow down the cataract a little. It buys you some time, until surgery is really necessary.
Okay, that makes sense. So let's talk surgery then. I'm not gonna lie, the idea of eye surgery kind of freaks me out. How big of a deal are we talking?
I get it. It's understandable to be a little nervous, but honestly, cataract surgery is so common and so safe. It's one of the safest and most effective procedures out there, really.
Okay.
Millions of people have it done every year, and the vast majority.
Yeah.
Fantastic outcomes.
Okay, hearing those stats definitely helps. But what actually happens during this surgery? Are we talking lasers, scalpels? Do they take out the whole lens? Paint me a picture, but, keep it PG rated.
It's actually way less intense than people think.
They make this tiny little incision in your eye, and then they use this tool. It's a high-frequency ultrasound thing, and it breaks up the cloudy lens into teeny tiny pieces.
So it's like sonically pulverizing those protein clumps.
Pretty much. And then once they're all broken up, they just gently suction them out.
Okay, that makes sense.
But wait, we can't see without a lens, right? So what happens once that cloudy one is gone?
You're totally right. You can't see without a lens. That's why they put in a new one, a clear artificial lens.
Huh.
It's called an intraocular lens, or IOL,
Okay.
and they put it right where your natural lens was, in that little capsule.
So it's basically like swapping out an old scratched up camera lens for a brand new one.
Exactly. Perfect analogy.
Nice.
And the best part is this artificial lens. It's permanent. You never have to worry about that eye getting a cataract again.
That's amazing.
Sign me up. Okay, so what's the recovery like? And how often does this actually work? Can I expect to, wake up with 20/20 vision?
Well, I can't promise 20/20 vision for everyone, but most people, they see so much better after surgery. Like, studies show that it's, around 9 out of 10 people see better after.
Oh, okay.
Yeah, and recovery is usually pretty fast. Most people are back to their normal stuff within a few days.
Okay, good to know.
Hmm.
But you mentioned earlier that, hazy vision could come back even after surgery. What's up with that?
Yeah, that's called posterior capsule opacification, PCO, they call it.
Right.
It can happen, a few months later, even years after you have the surgery.
Mm.
Basically, the back of the capsule, the part that holds the artificial lens, it can get a little thick, maybe a bit cloudy.
So it's like a window that, it gets clean, but then that condensation builds up again over time.
Yeah, exactly like that.
Okay.
So not ideal,
Yeah.
but not the end of the world either.
Exactly. The good news is we can fix it.
Okay, good.
It's a super quick, painless laser procedure. Capsulotomy, they call it. Basically makes a tiny hole in the back of the capsule, and boom, light can pass through again.
Nice.
Takes just a few minutes, and it's really effective at getting that clear vision back.
Wow. Okay, that's good to know. So even if cataracts happen, it seems like there's a lot that can be done.
Absolutely.
But ideally, we want to avoid all this for as long as we can, right? So let's talk prevention. Are there things we can do that proactively to keep our lenses nice and clear?
Absolutely.
Yeah.
A lot of it comes back to those healthy habits we were talking about.
Yeah.
Protect your eyes from the sun, wear sunglasses.
Right.
If you smoke, try to quit. Keep your blood sugar in check if you have diabetes. And eat lots of healthy foods, lots of antioxidants. All those things, they make a huge difference in protecting your eyes.
And of course, regular eye exams.
Yes. Couldn't agree more. Early detection is key.
I like to think of those eye exams like taking your car in for a tune-up.
Find the small things before they turn into big problems.
I love that. Perfect way to put it.
So as we wrap up here, I just want to say, we hope this deep dive into nuclear cataracts has been helpful, maybe even a little eye-opening.
I hope so too.
Until next time, everybody, stay curious, keep learning, and take good care of those peepers.